Hello, this is Dr. McLean, and I want to first point out this is only for patients that I've directed to come to this video. We're going to talk about posture. We're only going to talk about posture of the low back. Posture as a whole is a balance of all of your different body parts, and if we shift one, another part shifts in relation to that. So if you're watching this video, I've already talked to you about posture in general, or you're supposed to come to posture class in order to get the whole picture. We're only going to talk about low back in this video. This is my daughter Jocelyn and Tara, my other daughter Tara. They're going to help us with this. So we're going to start on all fours, so like a puppy dog, and we're going to look at the back position that they're in right now. So this is their pelvis is here, and then their low back, and then their femurs are here. So when we ask them to pretend as if they were a puppy, and a puppy has a tail, okay, we also have a tail, but not the same length as a puppy dog's. I'm going to say the puppy dog is a sad puppy. When he's a sad puppy, he drops his tail between his legs, and they tilt the pelvis, okay? So you can see this, their back is curved here. Now, if they're a happy puppies stick their tail up in the air, and then you can see this sway back. In yoga, this is referred to as cow and then cat. So we're going to go sad puppy again. So sad puppy up, and then happy puppy again. All right, now we're going to find the middle. So in between those two would be neutral, okay? Their movement of extension and flexion, which is what we're talking about, the pelvic tilt under and up again, is perfectly normal. It's not excessive. It's what everyone should be capable of. Most of you will start with this as an exercise, tucking under and sticking out, tucking under and sticking out, okay? This is the neutral position of the spine, and you should maintain it at all times, okay? This is where your strength comes from. You want to work towards strengthening in this position. So Joss is going to go onto her back. Okay, Tara, you can go on your back if you want. I don't know if you can be seen in the shot or not. Okay, but her pelvis is here, and her spine is on the back. If I tuck my hand in behind here, which I did to all of you in the treatments, I can feel her back. She's in neutral here. Now, some people are actually in sway in this position because, go and sway for me, like this, maybe not quite as much as that. Tuck down a little bit, go back to neutral. Because the front of their legs are so tight, they pull the body up, and then you end up in this arch position, which is why when we sleep, it's recommended that we bend our knees, because when you bend your knees, the way your femur hits into your pelvis, it causes you to be tipped a little bit more. So which puts most people in neutral when their knees are a little bit bent. So that is why we use a pillow when you're sleeping, because it's naturally just tips your pelvis into neutral without any pressure. So now I just want to show you the pelvis is here and the femur is in here. So it actually is a lever, and everyone's built a little bit differently, the way their femur fits into the socket. So when the femur bends up, we'll watch Joss's back tilt. So her pelvis will tilt right about there. So as she gets in, her pelvis is forced into the tail under position. So this comes into play when you're doing squats. Okay, so again, that's a different topic. We have talked about that in our treatments if you were one of those people. So now we're going to talk about sitting. So I'm going to have Joss sit up at the end here. Tara can sit here. Yes, Tara can sit with her back to you. That's good. Okay, so both of them are actually sitting in what we call neutral. Okay, so I'm going to have them both tuck their tails under for me. So tuck their tails under. That you can see that's a bit of a slouch there. And that's how most people sit, unfortunately. Go back up into extension. So this is with the tail out. So tail out, you can see quite a sway. Then tail under, and then tail out. All of these are normal positions for the back to assume. Go to the middle now. So we go to the neutral. So neutral is where the spine is the most comfortable. There's the least amount of pressure, and this requires us to hold this position. But it's not really holding. It's only balancing our posture, okay? When we slouch and we round our backs, it's a lot less muscle activity, but there's a lot of pressure on the joints in the spine. So when I ask them to go into neutral, they come up. They have to maintain this with some muscle strength, but not a lot. Most people's problem is they don't have the endurance to maintain this, okay? So now this is sitting nice and upright with no support. So if we wanted to sit with support, I'm going to have Tara do this one for me. Come into this chair. Just because Tara got a shorter leg. So when she sits in this chair, she's not at the back, which happens to a lot of people. So sit down again for me, Tara. So it happens to a lot of people. Now when she goes to lean back, her pelvis tips back. You can see how her tail's under. So she's basically slouched. If she forces herself to hold neutral, you can see there's quite a big gap in there. And that's a little uncomfortable. She has to maintain that for however long she's sitting there. And that takes a lot of endurance. So we're going to have her lean forward. And this is what pillows are for. So if I stick a pillow in the back there, she's now supported in the neutral position, which is where she should be. So that's what we like to see. The other option is if, say, she was sitting in a comfy chair or a couch, really long couches that have not enough leg room for her or too much, sit crisscross front of her. So see, she brings her butt way to the back and then she leans back. So she's eliminated the effect of her femur in that position, which is a good thing. So throw pillows or scoot your butt way back, especially in your car, you want to do that. And now we're going to do standing. So let's have you stand. Can you go around the front? Joss can stand too in the front, right here. Okay, so stand back to back probably. Okay, well, not. Get a little bit of room there. Okay, so from this position, they're both standing in. Joss has there you go. She had a little bit of a sway there. So separate your knees for me a bit, Tara. So you just separate your knees. Okay, so when you're standing, they both have a little bend in their knee, and that's what you should have. So when Joss locks her knees again, you can see how her butt sticks out, and that's what's happening. So because her hamstrings are pulling when she's like that, they cause her to arch her back or sway her back, and we don't want to see that, but that's a lot of people do that. So go into tail under, good, tail under. All right, now stick your butt out again, stick your butt way out, okay, and then go to neutral. So what I've given you guys as exercises at home is to work on finding your neutral and maintaining your neutral. There's one more that they haven't heard about this. I'm going to ask you to bend forward as if you're going to pick something off the floor. So now when she bends forward, you can see, there you go, Jossie got on right away. So you stick your butt out when you bend forward. You try bending your knees a bit, Tara? There you go. Because when you're bending, you want to maintain that sway. Now come back up again, okay? Now the other way, if you bend forward and you don't sway and you curve your back, there's that curve in the back, and that's harmful for your back. So you want to stick your butt out. So bend your knees a bit more, Joss. That'll give you that sway, okay? So that's all. Thanks very much for watching.